Thank you, Dr. Tanzi, for inviting me. My name is Rishi Chopra. I'm a practicing dermatologist at Union Derm in New York City and Long Island, and today I'll be closing out this session discussing the latest fractional technology, which is microcoring. How many of us have heard of microcoring and familiar with it? How many of us have used the device? Okay, a couple of us. Okay, awesome. So just to begin, I do have relationships with Cytrellis who make the microcoring device. I'm going to do my best to be as objective as possible. And so I want to start off by presenting this patient. So I think we're all familiar with the patient that walks in, has moderate laxity along the jawline, jowls, moderate to deep nasolabial folds, marionette lines. What do we do for this type of patient in terms of tightening? How do we treat moderate facial laxity? So when we look at the spectrum of skin laxity, from mild to moderate to severe, we really have treatments for severe. We have surgical treatments such as facelifts. For mild laxity, as was previously discussed, we have our ultrasound and our radiofrequency treatments, which do a pretty good job. And then microneedling plus or minus in terms of its improvement in laxity. But for our moderate patients, what do we really have in our treatment armamentarium to actually produce an efficacious result? And so the ultrasound and radiofrequency treatments don't really work too well, and these patients are too early on in their skin laxity journey to really undergo a surgical revision and experience the downtime of that procedure, also the cost of that procedure. So what do we do? So cue microcoring, which is the new state-of-the-art fractional technology, and I think we really gloss over this feat of engineering in terms of how these needles were created. This was a device that was developed at Wellman, and it took over a decade to really hone down on what the modifications of the specific needle are. And so this is a two cutting edge, 10-degree needle, 6 inches long, and they had to really figure out the angle of the needle, the length of the needle, how fast that needle was going to be deposited into the skin, the width of the diameter of the needle. All these things went into developing the state-of-the-art needle, which is actually very different than our needles on our microneedling devices. So our microneedling devices, on the other hand, are solid needles. They're duller. Our microcoring needles are extremely sharp with 2 cutting edges, 10-degree angle. They're actually very similar to punch biopsies. If we really think about the cutting edge, it's like a circumferential cutting edge. And what we're actually really doing is we're removing a punch biopsy. So we're using a hollow 22 gauge needle to remove about a 0.4 millimeter punch biopsy. And so we're all derms here. We extract a microcore of the epidermis and dermis, a full skin graft of tissue. And what I love about this mechanism of action is very easy to explain to those in medicine and those that aren't in medicine, those that are 5 years old or 50 years old. We're removing skin, there's a hole there, the wound closes, we get tightening, we get rejuvenation. There's no energy and no scar, and that's really a miraculous feat of engineering. And so these are the cores that are removed after a treatment session. We remove thousands of cores on the face, as you can see here. These were removed from the filter directly after the treatment and placed on a towel. And so the mechanism of action of microcoring depends on 2 critical steps. The first is that skin is removed scarlessly, and the second is that the wound closes and there's tightening. And so these 2 steps are supported by 2 critical studies. The first step, scarless skin removal. This was a study performed at Wellman, where the abdominal skin was cored using different core diameters, different needle diameters, and they looked at the probability, the development of a scar. They looked both clinically and histologically. So from 1 millimeter to 0.8 to 0.6 to 0.5, what they found is as you reduce the diameter of the needles, clinically you can see on the left-hand side of the photos, less hypopigmentation as we reduce that needle size, less atrophy. And then we look at the histological photos, we can see that there's this bluish hue in the dermis in that 1 millimeter, the core. And then as we move down all the way to 0.5, you can see that the bluish hue has disappeared. And so what they found was that at this basically 500 micron cutoff, that's when you get no scar with skin extraction. So that was critical. But that's just one part of it, right? The second is, do we actually produce a clinical result? And so the second part of the study was performed on preauricular skin, and what they found, they basically did 10% density of these coring needles, and what they found at day 30 is that the 10% density equated to about a 9.4% reduction in skin surface area. So about a 1% density, 1% skin surface area reduction. And so these two studies really prove the mechanism of action for this Cytrellis device to be developed. And so this is a really critical slide because it really shows us how this device is so novel, right? We have a lot of these other devices that we talked about today, RF microneedling, CO2 lasers, high frequency ultrasound and radio frequency. And so the way that I break down all these devices is, does it go superficial and deep? Does it remove skin? And is there any heat deposited? And we can basically break down all the devices into those three categories. So for RF microneedling, we puncture superficial and deep. Heat is deposited deep, no skin is removed, right? For ablative CO2 laser, more superficial, ablated tissue, so skin is removed, but there's heat deposited, so you got that coagulation along the column. And then for high frequency ultrasound and radio frequency, it's basically a deep treatment, and you're depositing energy deep into the dermis. Unlike Elocore, where you're removing a full epidermal dermal skin graft, so there's no tissue left behind, and there's no heat deposited, and we're going superficial and deep. So in terms of the procedure, how does it work? So we basically, this is me holding, I think we have a little clip to play. So I'm holding this device over here. You can see there's 3 coring needles there, 22 gauge coring needles, 10 by 10 millimeter treatment window. And what's great about this device is you can adjust both the depth and the density of the treatment. So this is treatment of the preauricular skin. You can see the skin is stretched, and you can see that these coring needles are able to remove tissue. And so how does this differ from microneedling? So it's a very, very different device, right? With microneedling, you have a standard tip, so that density is predetermined. You basically adjust the heat and you adjust the depth. With and as you can see here, it's a very gentle treatment, right? It just slowly into the skin. On the other hand, microcoring, these needles are rapid. They're getting that skin out. There's blood involved. We're really performing almost minimally invasive skin surgery. It's a very different type of treatment, so it's very different than microneedling. So we treat from the zygoma down to the mandible, from the preauricular area to the perioral area. And so in terms of results, we get improvements in laxity, and what we've been really, really surprised and really reassured about and excited about is that the perioral area does extremely well. The upper lip lines, the barcode lines do very well, almost like an ablative procedure. The perioral lines, I call them accordion lines when you smile on the medial cheek. These patients do really well. And what's also great is that these results have been resilient. This is one of the first patients that was treated at MGH. You can see after 2 treatments, her smile lines around her mouth have really improved. And then even 2 years later, she's better than baseline. So very exciting. So this is a study that was presented at ASDS last year by Jill Weibel, very, very exciting, out of her lab, is that they did a study on 10 patients, and they found that there was an increase in collagen gene expression. So there's a lot of collagen remodeling going on, and in terms of the health of the skin, we're very excited about what the microcoring device can achieve. So who's the ideal microcoring candidate? This is extremely important. As was discussed by the previous speakers, that consultation is very, very important to pick the right patient and make sure that they have great results. I like to choose patients that have both wrinkles and laxity. If they have upper lip lines, they have those etched lines on the medial cheek, that's a great candidate. This is not a facelift. We want mild to moderate sagging skin along the jawline, not anything that would require a facelift, because the patient's not going to be happy, because this is not a facelift. This is minimally invasive skin extraction. You're going to get tightening, you're going to get improvement in wrinkles, but setting patient expectations is extremely important. So in terms of anesthesia with microneedling, we just do topical numbing, right? On the other hand, with microcoring, topical numbing, nerve blocks, both infraorbital and mental, and then on top of that, we do some basically like a light to medicine anesthesia to really infiltrate the cheeks and perioral area. So in terms of endpoint and procedure optimization, with the microneedling device, as was discussed, it's hard to really get an endpoint. This is actually a pretty terrible treatment. You can see there's gaps, there's pinpoint bleeding in certain areas, there's mild erythema in certain areas. You can kind of you can try to optimize your treatments with RF microneedling to kind of deliver a standardized treatment, but you don't really know if you're going to create a great result, right? With the microcoring device, you actually can see whether you're extracting the skin, and whether or not you extract the skin will determine whether that patient gets a good result. And as you can see on the left and right here, we have 2 cheeks treated. On the left, there's low core yield. This is the core and the filter the cores in the filter afterwards. On the right, a higher core yield. And if you look at the holes that were made, you can see that there's skin still left behind. So we're not getting all those cores out. This procedure is not a point and shoot procedure, and that's kind of what I love about it. It really involves a lot of your dermatology, your surgical skill set to deliver good treatments. And so we vary density and depth. Those are the two things that you can vary. Now, depth is extremely important. You're going to vary the depth throughout the treatment based on where you are on the face and what you're looking at after you perform a pulse. And so, as we know, depth, dermis depth varies across the face. On the cheek, it's going to be deeper. Around the perioral area, you're going to have less depth to the dermis. And so you really have to vary that depth throughout the procedure, look at what you're doing, and then adjust and calibrate. And so we talk about clinical endpoints for lasers. There's clinical endpoints for microcoring as well. So we want optimal core extraction developed. It depends on 3 critical steps, and they're all predicated on each other. We want good contact, we want full penetration through the dermis into the subcutaneous tissue of those needles without contacting bone, without contacting the teeth, right, in the perioral area. And the third is that the cores actually get extracted. And so this is an example of different pulses that were performed. As you can see, on the left, almost no cores have come out, and you steadily move towards the right, you can see that there's almost 100% core penetration of those needles, right? There's heme coming out of all those holes. But if you look really closely, there might be heme coming out of those holes, but there's still cores left behind. To deliver a good treatment for that hole to close, we need to get those cores out. It's just not penetration, it's extraction as well. So on the right, we have 100% extraction of all those cores. So this is the optimal clinical endpoint here. And what I really think is awesome about this procedure is if you get really good at it, we're able to deliver really good results for our patients. And it's an analog skill. It's almost like doing a cannula, I would say. You have to really have a feel for the tissue and understand what's going on, use all your senses to deliver a good treatment and get a therapeutic result. So you have to have the skin stretched so that you provide a steady surface, that the dermis shrinks so that you can get the needle all the way through it. You want to make sure the force of suction is not none of the cores have clogged the suction. You want to make sure the flange suction seal has created a stable surface for those fast, rapid needles to penetrate the skin. You need counter pressure in areas because your cheek is very, very pliable. There's no counter pressure behind for those needles to really deliver a good treatment. You want to make sure the handpiece is stable. You want the force of compression to be pretty firm to make sure that you're getting all the way through the skin. And you want orthogonal penetration, right? You don't want penetration at different angles. And finally, you want to make sure that you're expressing those cores afterwards and getting those cores out to deliver a good treatment. So it's a really, really interesting therapy for our patients, and I think it's going to revolutionize the way that we treat laxity. You can see here we have counter pressure with a popsicle stick in there. We have a stretching of the skin. We have firm pressure. It's a very, very it's actually a very gratifying procedure to be gratifying treatment because you're able to deliver very effective treatments if done well. So microcoring, much more than a mere needle, and I think it's going to be a game-changer technology poised to transform the way that we not only treat laxity, but wrinkles as well. Thank you.